Good morning. We'll call this meeting of the Assembly's Committee on Housing and Homelessness to order. Today is July 21st. We are noticed from 11 to 12:30 p.m. I'll go ahead and have Travis call the roll. Thanks.
Ms. Allard? Mr. Constant? Here. Mr. Dunbar? Here. Ms. Kennedy? Ms. LaFrance?
Here.
Mr. Perez-Rivia? Mr. Peterson? Present. Ms. Quinn Richardson?
She's excused.
Mr. Rivera? Present. Mr. Wilson? And Ms. Salto?
Present. Thank you. I'm actually going to run through the agenda here really quick, and then we'll turn to the person who signed up for initial audience participation. We have our standing healthy spaces update, an update on outreach, just a note on that. That's actually going to be a combination of presentations led by the coalition, Anchorage Coalition in Homelessness, the by name list and point in time count update, and the mass care update, and that'll actually be from Development Services. I apologize for the error on the agenda. Note for the record, we've been joined by Ms. Kennedy. So I had Janice Strickland sign up to give initial audience participation. If you'd like to come up, we now have 3 minutes. And there's a button there on the mic, I think it's yellow, that you need to push. Oh, one more time. There, you're on. Please go ahead.
Good morning. As already said, my name is Janice Strickland, and I'm very interested in what our Assembly is doing related to the shelters for the homeless. I'm going to begin with a quote from Dr. Martin Luther King, which I think is very apropos at this moment. People with good intentions, but limited understanding, are more dangerous than people with total ill will. I believe that all of us count on all of you to do that which is best, not only for our homeless, but also for our community. We have chosen you to act and to vote for us. I did find great comfort, perhaps, in the appearance of compromise in the article by Ms. Irby. Now, I must say that I understand well the mayor's position. He has placed himself in a position beholden to certain groups of voters to whom he has promised no shelter in his area. I support shelters. I care about other people, and I care about our weakest, our most vulnerable. But I think when you are making this decision, you must care not only about them, but also about the people whose taxes will pay for this enterprise, the people whose neighborhoods will be affected. Now, I'm going to take on good faith that everyone is working in good faith. I must admit I was shocked by Dr. Morris's comment when he said, if I learned that such a project were going to be in my neighborhood, I would be concerned as well. Hint of a bit of hypocrisy. Ladies and gentlemen, thank you for listening. I bid you good day.
Thank you. Thank you for participation. All right, with that, we're going to go ahead and turn to the first item on our agenda. We'll turn it over to the Director of Parks and Recreation, Director Durant.
Hello. So Healthy Spaces Division, it's a new division within Parks and Recreation that addresses the cleanup of homeless camps within our public spaces, as well as reduce trash throughout these public spaces in Anchorage Fall. To date, and for this year, we have cleaned up 200 tons of trash. And if you compare that to last year at the same time, we were at 150 tons of trash. Also looking at the date this year, we have cleaned 150 camps have been abated so far, and last year we were about 200 camps. camps. So why are we seeing that difference? Less camps, yet more trash. That's because we also focus on loose trash throughout our public spaces, right-of-ways, trails, sidewalks, etc. And other statistics that I think are relevant, this year we're having less camp reports coming in. And again, the reason for the more trash is the expanding scope and the removal of that in public spaces. Last week, the division was working in the Camel Creek corridor and specifically near St. Mary's Church. And we are also removing some camps within Tekishma Park. Right now, we are working at Elmore and Dowling and in the Goose Lake area. In the Goose Lake area, there's not a significant amount of camps, but we do have an active black bear situation there that was creating some safety issues associated with an individual camp. We do have currently 3 closed spaces to the public that provides a control mechanism for the CAP team, not allowing camps to come in these places. And these are areas south of the Chester Creek Sports Complex, north of Rogers Park, the old Native Hospital site downtown, and soon to be the snow disposal site within the Mountain View area. And Real Estate Services has been leading that charge to have that closed, and that should be realized very soon. Next week, or towards the end of this week, we'll be transitioning into the Taku Lake area to some found camps that are quite hidden. We actually can't access these camps through public property, so we're working out access with QAP and a gravel facility that's west of the park. So we'll be addressing those later this week. And the CAP team does continue to alert outreach of our abatement schedule, and they do this on a weekly basis, so outreach can get to the camps that are planned for abatement prior to our crew showing up. And in about 10 days, we'll be transitioning to the new camps that have came into the Mountain View snow disposal site and also the other public safe spaces radiating from that area. And that's all I have to say.
Great, thank you. Note for the record, we've been joined on the telephone by Mr. Weddleton, and if we can make sure we get close to our mics to speak, because they're having a little bit of a hard time hearing us on the phone. Mr. Constant.
Thank you, Mr. Grant. We briefly spoke earlier about the Northwood Park area. Can you let folks know, because we did receive some email communications?
Yes, through the chair and to Mr. Constant, thank you for that reminder. I completely skipped that bullet point that I had on my list. We do have some camps within the Fish Creek corridor. The reason they have not been addressed yet is they actually exist on private property. It does appear that they are in open space, but the CAP team has been having coordination with the property owner, and the camps, they will be trespassed soon, and I understand that the property owner has an interest in doing some vegetation management to discourage future camps from coming in. Thank you.
Just a quick follow-up. Last month, maybe it was 6 weeks ago now, we had an outreach from a concerned neighbor who was trying to maintain Wilson Park on behalf of the kids in the neighborhood. And there were some structural issues. And on my tour of Northwood yesterday, I went around to Wilson and saw that the Parks Department did make some substantial visible changes in a very brief turnaround. And I'm really grateful that he did that for those neighbors.
Thank you.
Great, thank you, Mr. Constant. Ms. LaBrance?
Thank you, Madam Chair. Thank you, Mr. Mayor, for the update. Do you have a sense of once an area is rated, how quickly the camps are coming back, or if there's any kind of change in that kind of return of the camps since like last year? Thanks.
Yeah, a great question. Through the chair, I think it varies depending on where we're in town. Like, for example, in the Mountain View area, what we find is we'll abate camps in one location and then they move to an adjacent park. Some areas, we abate the camps there, then it goes for about a month, they don't come back in, but then they do come back in. The one big difference I do see from this year is we do have less camps, and things do look a lot cleaner out there, and I do think that's attributed to having more shelter capacity and I think a more inviting atmosphere as it relates to that.
Thank you, Madam Chair.
Thank you, Ms. LaFrance. Any other questions for Parks and Recreation before we move along? Okay, with that, we're going to have an update on outreach. I'm going to have the Anchorage Coalition to End Homelessness kick off the conversation, but I understand we may also be joined by 2 of the outreach providers as well. And it looks like the mic is already on.
Thank you. If we can go to the slides on the homeless, yeah, perfect, thank you. I wanted to start with an update of outreach prior to.
Can you introduce yourself, please?
Yes, I can. Hi, everyone. My name is Taylor Donovan. I'm the Director of Operations of the Anchorage Coalition to End Homelessness. About a year ago, the Anchorage Coalition to End Homelessness, as well as a couple other providers in Anchorage, received funding to begin more extensive outreach throughout the community with a focus on unsheltered campers and connecting clients to resources. If you want to go to the next one, thank you. This began with examining how outreach had functioned prior to last summer. Often there were a few outreach providers, but they were focused on finding specific clients. So I'm a provider, I have a housing resource for Joe, and I'm going into the community looking for Joe. I may run into other clients, but I'm not connecting them to resources, nor am I recording that I'm running into them. I'm just looking for Joe. When we began coordinating outreach in partnership with Rural Cap and Choices, we began doing blanket outreach through the community with a focus on connecting all clients experiencing unsheltered homelessness to resources, either shelter or available housing resources. We looked at where people sleep, where they're congregating, and where we're seeing mixed use in the community. So where someone spends the day may not be where they sleep that night. If you want to go to the next slide. Over the last year, we've had a team of about 5 outreach workers throughout the community who have contacted 1,548 unsheltered clients in 12 months. Of those, about 1,100 stayed in shelter at some point during the year. That means that about 429 clients never accessed shelter in that time. They spent the year unsheltered. Either for a portion of the year or the entire year, they never accessed shelter. Of those clients, we connected 316 to coordinated entry, which is a prioritization process for housing, and 106 of those clients moved into housing through new resources, specifically housing problem solving. Of those contacted clients, 550 were unsheltered and brand new to homelessness, so they'd never accessed shelter and they'd never been contacted by outreach prior to last year. Through this coordination over the last year, we've been able to work with clients, connecting them to shelter and connecting them to new resources in the community in order to achieve housing and stability, but a focus on a new connection to Parks and Rec and the police department with the idea that we're contacting clients who are unsheltered as their abatements are happening with the goal of, as the director was just saying, not moving clients from camp to camp and focusing on connecting them to resources or other shelter options. Thank you.
Great. So any questions for Taylor before we provide the opportunity? Is Choices here? Awesome. Okay, and Rural Cap? Okay, just Choices. But any questions for Taylor? I do have one. I'm going to kick it off. Can you talk to us about what housing problem solving is? That's a new term we've heard here.
Yes, and this is actually a program operated by Choices, so they'll be able to expand on it when they're up here. But the idea is that often clients who are new to homelessness, or even those who have been in homelessness for a while, need a small amount of assistance to solve their housing crisis. So for example, we recently had a client who had been staying with a friend. While he was staying there, he accidentally broke his friend's television. His friend kicked him out because he had damaged the TV, and he became homeless after that. Through meeting housing problem solving, he was able to say, this is the one barrier I have, my friend will let me live with him for free, but I broke his TV, if I can buy him a new TV, I can move back. We helped him buy a new TV for his friend, he was able to achieve housing and has not returned to homelessness since. That's one example. It could be a security deposit, it could be has employment but needs help with transportation briefly, things like that, minor assistance.
Great. Any other questions? All right, well, I'm going to welcome up Choices to give us a little bit more information about what's happening because they are the provider in the field. It's on.
Hello, my name is Lauren Toy.
Can you actually, since there's some folks on the phone, you pull the microphone closer there to speak up, that makes.
First time. My name is Lauren Terrell. I'm the lead housing case manager for Choices for the HPS and PATH program. We have a team of about 5 of us that go out and handle outreach. So that team goes and meets everyone that's in the tents, on the side of the road, going to Noble. And I kind of stay back in the office and I handle all of our HMIS, coordinate entry, kind of sustaining for my director who handles more of the coalition side. And so with our program, we try to focus on those who are experiencing homelessness. We really are trying to focus those living in the tents right now who have an income or want to try and get income because we have vocational specialists as well. Last year from November till April of this year, we housed 154 people out of the 300 or so that we actually met. And about 130 of those are still housed successfully with our, either we would help first month in deposit or we would help up to 4 months if they had their SSI pending. So we really tried to push for their recovery by client pushing themselves for it, why we wouldn't do it. So we really want our clients to want their own success rather than us wanting it. And so that's how we really use our outreach teams to push them into coming in, interacting with us. We give them like incentives, we bring them socks, snacks, meals, whatever they need. That way they can be more open to us because they get a lot of, well, I've already talked to this program, I've already talked to them, and they don't help. And so we try to keep that connection going on daily if we can meet with them. And then they also go and help with the vaccination clinic for Visit Healthcare, trying to get more people open to getting vaccinated because they know my team. And so we just really want to be out there and help as much as we can and where we can. And so I thank you for having me up here. I wasn't expecting it, but thank you.
Yeah, so we may have some questions, so please don't go away. Ms. LaFrance.
Thank you, Madam Chair. Thank you, Mr. Rowe, for being here. And could you just speak broadly about the organization you're part of, Choices? I apologize.
No, you're good. So Choices, we have about 3 different programs. I'm a part of the HPS PATH program. PATH is Propelling Alaskans Through Hope, HPS Housing Problem Solving. We also have an ICM department, which is Intensive Case Management. They help more substance abuse, and they also help with housing as well. And we also have a peer support program that is more one-on-one with the clients, taking them on their daily needs, all sorts of different stuff like that. And so me being part of the HBS program, sometimes we have mutual clients between the programs, but we welcome as much and everyone as we can to help.
Great, thank you. Ms. Kennedy.
Thank you, Madam Chair. Thank you for being here. I was kind of interested in a comment that you made when you were talking about some of the people that you were talking to who said that another organization didn't help them. So can you speak a little bit to what's happening there? What are the reasons? Why is it that people can go to certain organizations and not get help? And then how are you able to fill that need then, fill that gap?
So with our HPS program, we had almost no limitations. Because we have found a lot of providers limit the eligibility to people who are either Alaska Native, they're either a woman with children, or they're a minor, like 18 to 24. And so we have a lot of elderly people who are Caucasian, Black, Mexican, all types of stuff, and they can't get any resources through, I think I've been told CSS a lot, because now they're primarily doing Alaska Native. I've been told that by 3 different people. And a lot of the time our outreach people, when we first make contact, the clients don't want to talk to us because they literally have said we've been put on the back burner by several other programs, and they always say we'll come back and we'll come back. And so my team has really been pushing to go back to even spots not on our map given to us, to make our presence known and let them know, like, we want to help, like, you're on our radar. And so we're really trying to push to help everybody and not limit that eligibility. But, they would have to be homeless if we can, help everyone as much as we want to.
Thank you.
Thank you. Mr. Rivera.
Thank you, Madam Chair. So this is a question for either for you or for Taylor, whoever would like to respond. So at the June 15th special committee meeting of this committee, we had a pretty good conversation around outreach. And I'm just going to regurgitate that conversation a little bit for folks who maybe weren't there. And then I'd love to get the opinion of the experts in the room, which I count you all to be that. So the administration, at the time, the incoming administration, presented a view on outreach that basically centered around engaging people, letting them know there is another choice, and the goal of capacity to outreach the entire Anchorage community. They talked a little bit about the roles of the municipality versus possible roles for providers, including role pack and choices. And some of the things that the municipality, the incoming administration talked about was the need for true coordinated entry and improvements to the HMIS system to improve the outcomes of outreach. My colleague isn't here, but Mr. Presberdia asked some interesting questions as well in this area, including the need for transportation funding and a need for some type of outreach plan that really easily defines the roles of what's the city's role in this, what's the provider's role in this. So as the experts, what do you think about all of those different aspects?
That was quite a few questions. I'm going to try and remember all of them. You might have to remind me. I think that, as she was just talking to, where often providers are limited by the populations they can serve in certain areas, specific to often grant funding requirements of how long has someone been homeless? Are they reaching a certain level of income? Are they eligible for various different sources? So what we find in terms of being able to spend flexible funding on things like transportation, on things like housing problem solving, has allowed us to fill some of those gaps in services. When we start to think about who's unsheltered, it's not that clients don't know shelters exist. They know those are out there. There's a barrier for them accessing those, and when we start to talk to clients about what those barriers are, I think transportation is a big one. Shelters aren't located where the client needs to be staying. They may not have access to certain shelters based on how they present or past history of that shelter. And what we often hear is that clients don't feel safe in certain shelters because maybe they have an abuser who's staying there, they've had negative experiences in the past, or they have mental health or behavioral health concerns that just aren't they don't fit into a shelter well because it's a large population. So I think when we talk about how do we make sure everyone has a place to stay, we have to look at who's not being served by shelter and what else do they need. Transportation is a piece, access to other resources is a piece, but it's also shelters that meet all of their needs when we're talking about very complex cases. And designing shelter to meet those needs for those clients.
Thank you. I just have a quick follow-up. Can you talk a little bit about HMIS and sort of what are the gaps in HMIS that are probably making outreach not as successful as it could be? And then what role do you think the municipality should take in outreach?
And just so everyone's on the same page with us, if you could say like one sentence about what HMIS stands for and what it is. Thanks.
Yes, I can. So there's two parts of that. HMIS is the Homeless Management Information System. That's a database used by 90% of providers in Anchorage, as well as providers throughout the state of Alaska, with the idea that clients who are homeless in Anchorage may be homeless elsewhere, and clients who are homeless elsewhere may be homeless in Anchorage. So it's a statewide data system that's managed both by the Anchorage Continuum of Care and the Alaska Continuum of Care. And then the second piece of that is what is coordinated entry. Coordinated entry is essentially a prioritization list of everyone experiencing homelessness in Anchorage with their basic information collected so that when a provider has a housing resource open, we're able to say, here's the most vulnerable person who's experiencing homelessness, who meets the requirements of your program, and because they're entered into HMIS, here's where they stayed last night, if that's available. Here's where they're sheltered or unsheltered and camping, and here's who they've worked with in the past so that we can easily have a warm handoff between providers. So that's the coordinated entry piece of it. The homeless management information system is a work in progress, I would say. It was managed by the municipality until about 2017, and then moved over to a statewide system in 2017. While we've done a lot of work over the last couple of years to increase the number of providers entering into that, and that's why our data from really 2019 onward is more accurate because we have 90%, 95% of providers entering into it. What we still run into is that often clients' protection or clients' visibility is not across all providers, and it's difficult for outreach, especially with how the system is designed, to say this is the exact location someone's camping, and then they went to shelter, and then they went back to camping. It's hard to follow a client through the system because of how it's designed, and there are some ease of use concerns around providers' abilities.
Great, thank you. Mr. Dunbar.
That's fine, man. Thank you.
All right. Well, thank you so much for joining us and giving us the outreach update. Thank you to Choices for your great work with clients. No, great. Yeah, we'll probably be having you back again. So thanks, appreciate it. All right, we are going to turn now to by name list and point in time count. This is a presentation by the Anchorage Coalition to End Homelessness. We're going to dive deep into some numbers. We're going to go ahead and let the full presentation go through, but be ready to jump back to slides if questions arise after we're done. Thanks. Welcome.
Thank you all. It's nice to see everyone again. This will answer some of the questions I think also raised by Assemblymember Rivera, so I think we'll be able to kind of flesh out what Taylor already talked about. Next slide, please.
Actually, introduce yourself, please.
My name is Jasmine Boyle. I'm the Executive Director of the Anchorage Coalition to End Homelessness. Just a quick background on HMIS. There's several reference slides in the appendix available for you guys as well because a few Assembly members reached out to me with specific questions. For example, who doesn't use HMIS in Anchorage? So all of that is available in the back of this if that's useful to anyone. As Taylor mentioned, previously the Municipality of Anchorage managed the software system. Somewhere between 2015 and 2017, HUD called out the fact that that is actually a tool that is required to be used by the Continuum of Cares in Alaska, of which there are two, and that the Continuum of Cares needed to make sure that that system was statewide. Much prior to my tenure, the decision was, of course, made to follow those requests. And from what I've been told, the two coalitions took over HMIS and hired a third-party vendor who works nationally called ICA to manage the day-to-day and the software administration. When we launched Anchored Home, one of the things that became very evident is that, set aside social services for a moment, there is a real business need to understand when we're talking about homelessness, how many people are we talking about? And purely from a systemic perspective, is demand increasing or decreasing? Are we helping people achieve housing stability? But in the aggregate for the city of Anchorage, are we doing what we are supposed to be doing to protect our community and the vulnerable? And if we are unable to look at that as a community, it's very difficult to answer those questions. In 2018, we had very few providers, and they were only providers that were mandated to report to HMIS through HUD funding. So it was impossible to talk to you or the public or certainly people experiencing homelessness about the totality of need, trends, changes, successes. So a huge part of Anchored Home is we need to do a better than counting people on foot once a year. And Taylor will talk a little bit about the history of that other data set. We'll get into that today. But there has been a huge effort between the two coalitions and our Institute for Community, ICA, the folks that manage HMIS, to improve this. So what you can see up here is we've had a 44% increase statewide in the number of programs using the software. I am frequently asked the question, where are people experiencing homelessness in Anchorage coming from? It's a state problem. We need state information to address that state problem. We've also seen an increase in quality, because what we also discovered is when you are a floor line staff at a shelter, when you're an outreach worker trying to help people, sitting down and spending an hour after meeting each client, entering the same data points week after week, it's not actually the wisest and best use of your time. So we've also been working on data quality, and some of that is changing process flows, but you can see a little bit of information on how since 2018, the quality of the information we're getting from our provider partners is significantly increasing, and I am so grateful to partners, particularly during the time of COVID, to prioritize the data system. Of course, there's systemic value from a business side in having this information, but it also impacts clients. If I don't know where Bob was last night, but we now have housing for Bob, we sit for months with a housing unit empty because we are all on foot looking for Bob. This is not Mr. Dole. This is a generic Bob. I just happen to have the privilege of working with Mass Care and Mr. Dole quite a bit. Perhaps he was top of mind. I think that the other thing that I want to just call out very briefly before we get into the actual facts is we have had a tremendous increase since COVID in the need for HMIS. Every new program funded by HUD is currently required to be in the system. So the hard work of the health department to get those ESG, CDBG funds out, every single one of those programs is now putting additional pressure on our software. Every one of those programs is going to have new data entry requirements. I'm very grateful that the Assembly chose to move $100,000 into HMIS this year for us to be able to address that increased volume. The state of Alaska has not done that. So one of the things that we're experiencing is, one, the Homelessness Leadership Council found private philanthropic dollars to allow us to be able to expand the system. That money did not show up this year. So we actually have almost double the utilization of HMIS today and $200,000 less funding. So I certainly want to share that, because the more pressure we put on the data system, the more we need to talk about how to fund it for the long term. Not why I'm here today, though. So the other thing I just want to call out very briefly is we know that there are problems with the software. ICA, in partnership with a statewide group, we're doing a comprehensive analysis of other softwares, and the goal is to migrate to a new software that better meets the needs of clients and the people that work with our clients by the end of this fiscal year. So that is in motion. If anyone is interested in being involved in that work, we definitely are interested in having you. Next slide. So it's frequently confusing to people when we talk about how many folks experience homelessness. I do want to call out our guests from Choices. We were not housing people directly from the streets into housing. The fact that we were able to move at least 100 people out of camps into housing and keep them there is an astronomical success. There are communities that still aren't doing that. The fact that we've been able to do that a year in is a testament to the work of Choices. And I bring that up because we heard a different number than the number Taylor used. And so when we begin to sort of dive into things at a program or project level, depending on funding sources, depending on what people are counting, the numbers can be confusing. There are bottom line, three ways that we talk about aggregate data on homelessness in our community. The first is how many people are in HMIS for the whole year. And that's the table you see at the bottom. So that's anybody that touched our system in Anchorage, that somebody took the time to enter into the system. You can see the numbers are going up. Some of that is better data. So as Taylor just shared with you, there were 1,500 people in camps last year that prior to last year we didn't have data on. That had some to do with COVID, but it's not necessarily all COVID, if that makes sense. The other thing is the point in time count, which you've all of course heard about. Just to give you a brief background, the point in time count is a one-time-a-year HUD-required event where we walk around the woods at night in Alaska in January and count the number of people we find. Now, I spent enough time in corporate America that when I showed up and was told that this is how we report to the community how many people are homeless, I found that lacking in thoughtfulness and expansive, I think, use of technology and use of better critical data points. We have to do that. We're going to keep doing it. It's a good checks and balances, but I don't balance my checkbook. That ages me. I don't balance my personal bank account once a year. We absolutely should not be talking about the number of vulnerable people sleeping outside in our community once a year. So we have migrated in Anchorage as part of Anchorage Home to a community process called Built for Zero. This is a national collaborative. They've helped more than 25 communities achieve functional zero and end, in many cases, unsheltered homelessness, certainly end veteran homelessness and chronic homelessness. A big piece of that work is the data. That I have an obligation to report to you month over month what our homeless trends are. That's done. That was quietly done and finished during the time of COVID, so we didn't get a lot of fanfare about it, but that is what we wanted to talk about today. Next slide. So very quickly, I want to show you the point in time count trends. Again, I don't find this our most reliable data point because this is one night a year in January. What the top line represents is the total number of people in shelter, in transitional housing, and found outside on that one night in January. So what you can see is that number was relatively flat until this year. And we saw that number go up by almost 300. That, I believe, is a direct result of COVID. Again, this also counted people in shelters. So the second line that you see is the number of people in our shelter system on that one night in January. And again, you can see that that number went up by almost 200. And then the bottom line is how many people were found in camps. I will say that 2020 was low. I was in charge of Eagle River at Chudiak, and the police pulled me over and said, "What are you doing? Why are you doing this?" It was 12 degrees. And as the EPD so gently pointed out, anybody that did live outside when it was 12 degrees probably had come inside for the night in some way, shape, or form. So we know that that number was probably low due to the temperature. We believe 152 to be a much more reliable number on that one night, particularly because street outreach was moving. But again, this is a weak data point. It is one we will continue to report, but it is a single night view of the challenge. Next slide. I spoke to you guys about Built for Zero. I do just want to compliment our provider community. Anchorage is the only community in the nation that was able to achieve national standards for a quality data set on homelessness for all subpopulations. Every other community picked one and piloted with one group of people. Anchorage asked to do it all, and we did it all. So this is youth, survivors of domestic violence, veterans, the chronically homeless, and everybody in between. But this is now on our website, and where I think it's really important for our partners on the assembly, this gives us 3 data points every month that I think speak to efficacy and the overall challenges. And that is, are we reducing the inflow into homelessness? Are we preventing people from joining the struggle? Are we helping people exit homelessness into housing? So how many people month over month are we moving into housing? And then I think the most important indicator for quality, how many of those people end up homeless again? And once we begin to have comprehensive data on that, which we now are beginning to have, we can begin to talk about quality and problem solving and reducing those barriers to make the resources we do have more effective. Next slide. So our hope was originally to pull up this dashboard, and obviously the technology doesn't allow for that today. So I will quickly say, please play around with it. Taylor and I would be very happy to do a tutorial if we could set up the technology. You are able to shift timelines to look at just COVID, look at prior to COVID. This dates back now to 2019. But I do want to say, as we enter into the last part of this conversation, which is using this data, how many people do we need shelter for this winter? I think that's the hot topic of the day. What I do want to point out, and this is not new because of COVID, we consistently have more people entering homelessness every month than we do exiting homelessness. And I think it's really important that we're all on the same page, that we are always going to need more shelter and more housing if we can't knock that trend down. So we really also not only need to focus on getting people into housing and reducing the existing number of people experiencing homelessness, we've got to ramp up that prevention and diversion work. And I think COVID has given us many successes in that space that we need to be thoughtful about as a community. And frankly, it's time for Anchorage Home to be redone. We accomplished the first 3 years. The world has changed around us, and so I'm looking forward to partnership with the Assembly and the administration on crafting that. And with that, next slide. I do want to talk, or actually have Taylor, who's our data guru, talk a little bit about the question of the hour, which is how many people need shelter right now, and what is our current capacity to address that? So if no one has questions, for me immediately, I'll turn it over to Taylor, and then I'll be here.
Yes, we'll go ahead and have Taylor go ahead, and then we'll come back to questions.
Hello again. So when we start to look at the total shelter need, I think we can all recognize that the need in winter is different than the need in summer. When we start to look at how to estimate the shelter demand in Anchorage, what we did is use the Homeless Management Information System, so HMIS, to look at how many shelter bed nights, is what they're called, did we offer in January of 2021 and then May of 2021. And that means how many nights were clients sheltered and how many clients were there. So if one client stayed in shelter the entire month, that would be 31 bed nights. If they were there for 15 nights, it would be 15 bed nights. In January of 2021, in Anchorage, we used just under 42,000 shelter bed nights. So all of the beds that were occupied at night was just under 42,000. When we look at May of 2021, it was about 27,500, just under. When we look at the length of the month, 31 days in a month, we are able to understand how many beds do we need to meet that same demand. So assuming that every bed is full every night, we're able to use 100% of our beds, we would need 1,352 beds for the active shelter users in January and 886 in May. Then we start to talk about, now that we have outreach and we have an understanding of who's unsheltered, we know how many clients were experiencing unsheltered homelessness in each of those months, and of those clients who never used shelter. So in January, that number is 185. There were 185 clients that outreach contacted at some point during the month, and those clients never moved into a shelter at any point in the month. In May, we see more unsheltered clients, and about the same number, 187, who never used shelter a single night. Of those clients, some may have used shelter, of the total unsheltered clients, the rest could have used shelter one night or 5 nights, it's hard to tell. When we start looking at then how many total beds do we need, we're able to say, if we want to keep everyone who was sheltered in shelter, and we want to be able to offer a shelter bed to everyone who was unsheltered in that month, we're able to get that total need. So in January of 2021, we have an estimated need of 1,537 total shelter beds, and in May of 2021, we had an estimated need of just over 1,000 shelter beds. It's worth noting that we did look at this for prior to COVID and saw roughly the same numbers, about 5% variance. We can go to the next slide, thank you. So when we start to talk about what's our estimated need moving forward, I want to talk through some of the caveats, and there are just a lot of unknowns in our community right now. So when we look at the caveats, our goal is to build capacity for the historic increase in winter. As we just saw, we had a greater need in winter for shelter beds, and build capacity for everyone who is unsheltered to have access to those shelter beds year-round. I think we all agree the goal is that everyone has a place to stay when they need it. So when we start to talk about this does not account for families with dependent children or youth under the age of 18. So we're taking out the family shelter process from this, recognizing that those are kind of two separate worlds and operate differently. It also doesn't calculate in any sort of housing surge efforts being launched by the community, new providers, new partners, and new programs that are coming online, just recognizing that a lot of those are still unknowns. We know there's funding out there, we know programs will begin. We don't have an idea of how many clients those programs will serve because they haven't signed contracts yet, and we don't have an idea of the timeline for those increasing. If the program's going to serve 400 clients, but not until next spring, that doesn't help us this winter. And then when we start to look at increasing capacity at permanent shelters, we know that because of COVID, many of our permanent shelters, and when I'm saying that, I'm referring to shelters that existed prior to COVID that have been in operation for a while, decreased capacity because of COVID and because of spacing regulations. We're not planning for those to increase because we don't know what those providers are doing. We also don't know how CDC regulations may be changing. And then it also doesn't account for an increase of inflow into homelessness because of an end of an eviction moratorium, because of COVID-19 spikes, anything like that that could cause an increase in homelessness. We're really looking at what's the demand on our system right now and not planning for a ton of changes to that. Next slide, please. Thank you. We walked through how we got those two top numbers, the 1,500 and 1,000 a couple of years ago, and then we looked at what's our current supply of beds in the community. So we have those year-round permanent shelters. Again, those are shelters that operated prior to COVID. And then we have the Sullivan and the non-congregate hotel beds in operation to get our total number of beds in the community currently. We did some simple math. The need minus how many we have gives us that gap for the winter and the summer. Again, of those total, we would need 1,200 beds to replace the congregate and non-congregate mass care and meet that new need, and then 879 beds if we were to retain the non-congregate hotel beds, and that's from the EOC dashboard and average utilization of those non-congregate beds. Next slide, please. And again, I talked through this a little bit, but we didn't really plan for an increase of outflow. We know that there are new programs coming on board, but we don't know how quickly those will ramp up. So just some kind of additional considerations. We know what's operating now, and we know that there will be new vouchers coming into the community in the next few months, along with intensive case management services coming online. And then again, we're waiting on those contracts to have an understanding of how many clients those programs will be able to serve, when they'll begin, things like that. That's all.
Great, thank you. So first in the queue, I have Mr. Webbleton on the phone.
Backing up a bit to the HMIS question, I heard that the Sullivan did not use that or didn't use it very well. Is that correct? And how would it impact the data?
The Sullivan is actively using HMIS. When they first began, there was some lag in training staff and their ability to enter data. I believe now our data quality standards require within 72 hours. I can't speak to if they're within 72 hours, but they're actively entering clients at least within the last couple of weeks. So we feel confident through the end of June.
Okay, thank you.
All right, do we have any other questions here? I'm sure we do. Ms. LaFrance and Mr. Constant?
Thank you, Madam Chair, and thank you so much for the information. Would you mind summarizing again the gap? I wrote down that the winter gap is 465, and is that with the assumption of the 1,200 online for the Sullivan, or the 800 with the hotel, or could you just review those numbers? Thanks.
And Travis, could you go back to that slide? Thanks.
So, to do it the quick way, because I'm not the data person, I just like the product of the data people. If we kept Sullivan and the mass care at the current,
A little closer to your mic, we can't hear you. Thank you.
if we kept mass care exactly as it is today, we would need an additional 465 beds to meet winter demand. Now, again, that includes the assumption that we have that we want to have adequate capacity to bring folks in unauthorized camps inside. So that does account for the new outreach information. If we keep the non-congregate locations, which I believe is a discussion that's still on the table, and we account for the additional demand, so simply put, if we just replace Sullivan and deal with the unmet demand, we're talking about 879 new beds needed for the current population of people experiencing homelessness. That's for winter. Now, if we go down to summer, we're really only talking about replacing Sullivan. Because our summer demand is significantly less than our winter demand. And a lot of that is due to seasonal employment, the migration of people around seasonal employment, and the likelihood of camping versus coming inside because of inclement weather.
Thank you. Mr. Constant.
Thank you. It's not obviously in this presentation, but do you have a breakdown of where people are by number and then what capacity can be expanded with the current providers as well, so we can kind of get a sense of what portion of these numbers are negotiable between us and the various providers?
We're meeting with the shelter providers on Friday to do that task. What I will tell you is slowing us down is the Delta variant. And so there was, at least on an aggregate level, interest from several providers in increasing their capacity. We're walking arm in arm with the CDC, who's still asking for that 6 feet of space, so they've changed that a bit. So we are hoping to not only identify who can increase capacity, but also if there are simple solutions, for example, bunk beds or different type of dividers or something that would allow a shelter provider with a moderate resource investment to expand. We are looking into that, but unfortunately the new Delta variant has caused even the CDC to pause a bit on some of the loosening.
Recognizing that that may cause a shift in timelines, I'm hopeful that you can also, in the list, gather what would be in a non-COVID environment, the numbers that they would be willing and capable of expanding to, so we can, in our projections over the next month or two or three, base our calculations on real potential numbers. Thank you.
Great, thank you, Mr. Constant. Mr. Peterson.
Thank you, Madam Chair. And I keep hearing and seeing the phrase eviction tsunami. And wondering if we have an estimate or any idea how many additional people will be needing housing if the eviction tsunami actually happens. Thank you.
It is a question we were working on answering with a number of partners, not the least of which is the AHFC. I think we've been doing a lot of analysis on how the rental assistance was distributed in Alaska in partnership with AHFC, and I must commend that in Anchorage, money was made available to renters in low-income communities beautifully. I think we did a great job of how that was implemented in Anchorage. AHFC at this moment, based on their projections and the unused rental assistance they still have, they're working through policy decisions. I certainly don't want to speak for AHFC, but my understanding is we might be opening up a second application pool for individuals. So I think when blended with the work from Alaska Housing Finance Corporation and also the assistance that we put in place through the Assembly, particularly with United Way and this notion of reaching out to landlords to say, if you have a tenant that's fallen behind, don't file eviction, contact us and we'll help you get the rent. That worked really well. United Way, I think, has a contract for getting some of those funds expanded, but it's very difficult to quantify. I will also say, though, that based on some work we've been doing with the state of Alaska, we have continued to see eviction filings throughout the pandemic. In fact, Anchorage is averaging about 3 eviction filings a day, despite the eviction moratorium. What that appears to be is a combination of some folks that don't know that there's an eviction moratorium and then things get caught up in the legal system. But also, I think the sometimes unknown reality that you can still evict people, just not for financial reasons. So if you have a tenant who's being problematic or troublesome to other tenants for different reasons, and unfortunately, that too impacts our shelters because we're seeing folks evicted from assisted living facilities directly into our shelters, which is a different piece of work we're working on with a number of folks in the Assembly.
Thank you.
Thank you. Your last comment there, I put myself in the queue, really teed up my question or comment, which is, can we talk a little bit about who is in shelter right now and some of the roadblocks? You know, I sit closely with the coalition and their partners during this housing surge, and if you could talk a little bit about the roadblocks we've identified for getting some folks through the housing surge, particularly as it relates to assisted living facilities and other programs where it's not necessarily that we just need a place for them, but that there are other barriers.
If it's acceptable to the body, I'm happy to speak about it at the aggregate, but we also have Downtown Home Center, Beans Cafe, and Catholic Social Services in the room, and they are the shelter providers, so I think they could probably speak to this much better than I. I'll say at the aggregate level, very loosely speaking, we're really talking about 3 categories of people in shelters, and this is lumping a lot of people with unique needs in categories, right? There are folks working. There are people that are working, just not working enough. And again, I'll let Lisa Souter talk about that if you'd like to hear more about that, because they've done some projects. Certainly Bob and Matt Scare have done some projects on this. There are people who have steady employment, who have sustained their steady employment, but their steady employment is not enough to get into the Anchorage housing market. We have a very expensive housing market, all things considered. And we have a shortage of affordable housing, particularly affordable housing that has ADA requirements for people with different abilities. There's also a category of people kind of in the middle who need a little bit more help, perhaps a couple months of help, people who would normally target for rapid rehousing. And then we have the most vulnerable, those that have been chronically homeless. And a lot of the work right now is tackling the unique needs of those people who really should be in assisted living homes, people with personal care attendants, people who are physically limited in their mobility. Mass Care shared a story with me about a gentleman who was placed in a hotel room because he's high risk for COVID, who did not have hands. And you think about, how is that gentleman caring for himself? How is he feeding himself when he is all alone in the hotel room with no assistance? He should not be in the homeless system. He should be part of a behavioral health response to his unique needs. And that's what we're working on with the housing surge. But again, if you'd like to hear, I think, the true facts from the street, we've got experts in the room.
Great, thank you. We will bring those experts up in just a minute. I'm going to go ahead and do the mass care update, but I want to leave room for that so that we can hear some of the on the ground. But let's first, before I forget, Mr. Constant.
Thanks, Jasmine. Would you, if you aren't already, begin tracking the number of people who fall into that category of in shelter and employed, or working towards employment that have those basic skills? Because as we've discussed, I want to make sure we're drafting and creating a plank of services that is vocational in nature and helps people be housed and work.
That is absolutely part of what the housing surge is intended to do, is we collect, imagine, if you will, that you are a line staff person in a shelter, and there are people coming in and out all day. You're asking them very basic questions. So you're probably not asking them, are you employed? What is your income? Do you have a personal care attendant or a guardian or some affiliation with behavioral health? We're asking the bare minimum. And again, some communities have evolved past this and are doing data collection not at the front door of a shelter. That's a different conversation. We're working on getting that data. It is a new ask of everybody because it's never been done before. I also think there's some opportunities to work with the state of Alaska better and differently on those with the unique needs. But this kind of goes back to what Taylor said earlier, that we could reduce the number of people in shelters right now if the appropriations that the Assembly made for all of those ARPA and COVID-related funds were made to organizations. I'm calling organizations daily to say, I know you got money from the Assembly. Do you have the money? Do you have the contract? Have you hired staff? And how many people are you planning to serve? Who are you planning to serve? And what I'm getting back is, we don't know. We don't have the money, we don't have the contracts, and we haven't done the negotiations on who we're going to serve. So the work has been done on your end with appropriating it. Now I've got to see it in the hands of providers so we can actually do what Chris is asking for, certainly, and the work of housing people. And I bring this up specifically in regards to this Assemblymember Constant, because 9-Star was a part of what you guys appropriated for employment. And I think it would be amazing to get 9-Star into the shelters, because there's the people just unemployed enough, but there's also people that want employment. And we have the tool now and the resources to deliver that. We just haven't made the dots connect. And I appreciate that there has also been an administration transfer and COVID, and we all have many other things going on. But that is one of the biggest barriers we have to actually reducing these numbers and getting a move on things right now.
Thank you. Okay, right now we're going to turn over to the mass care update. Stick close, I'm sure, Jasmine and Taylor. Thank you. As I have the feeling my questions might come up that cross a few agenda items. And for mass care update, we have Bob Dole with us. Please take it away, Mr. Dole.
Good morning, Bob Dole, Development Services Director. Next slide, please. I know the name of this committee, and I'd like to start off by highlighting that mass care is not a homeless program that we're talking about here. It is rather it's recognized by FEMA's Emergency Support Function number 6. The intent is to provide temporary shelter. It is not a homeless program dealing with the stunning and difficult, complex, long-term challenges Coalition and its members have been talking about with you here today. The group that means we're serving, and the reason we have this function stood up for the COVID response, is that delta, or that change in the population, driven by 2 factors in relation to COVID. First, the economic dislocation. We talk about those increased numbers who experience homelessness for the first time. Second, this, the 1-2 punch going with that is the same time that happened, COVID also basically required shelters to cut their capacity in half due to social distancing requirements. So when we talk about mass care, we're not talking about a homeless program or HUD. We're talking about FEMA funding something necessary and reasonable to respond to the COVID pandemic. In that regard, we're spending about $3 million a month. We'll break that out shortly And the period where we're eligible for reimbursement for those reasonable and necessary costs is driven by time, purpose, and amount. First time, it has to be during the period of the federal declaration. The federal declaration does not have a specified end date at this point. Second, purpose. It has to be necessary to respond to COVID. In this case, it's necessary because we're responding to that change in capacity and change in requirements created by the pandemic. And third, amount. It has to be reasonable for what we're doing with the amounts there. It has to be causally related. There's some confusion because by executive order, the feds are paying 100% of reimbursable costs for costs incurred through the end of September. After that point, we go back to a 75-25 split between the federal and the state side. Normally, for bigger disasters, you'll have a period of 100% federal reimbursement. That's what we're seeing here. After that, we go back to your more typical disaster, if you will, and reimbursability. The state of Alaska has agreed in its public assistance grant application with FEMA that it will pay that 25% for emergency protective measures such as mass care, vaccinations, and testing as we go forward to combat COVID going forward. And once the federal disaster ends, the period of eligibility is 6 months after that, but it still has to be reasonable and necessary to deal with what COVID caused, that delta or change in capacity and requirements for the homeless population in this case, not just, it's not just a blank check during that period. And again, the end date has not been specified. Next slide, please. We talked about, there's a lot of discussion of what costs and how much in mass care. These are some breakouts for you to give you a quick overview. For your baseline 350-person Sullivan shelter, you're looking at spending about $913, and about 60 grand, and if we're going to increase that to 400 for funding going forward. And this actually captures all the different costs in there with the exception of a $25,000 cost for non-critical transportation. That's to take people for testing or other things. We kind of split that cost amongst all the facilities. Next slide, please. For what the other services cost, we can, for almost 1.2 million a month, house up to 390 in non-congregate shelter. That's an increase from the 360 that you normally see on the dashboard. We found a way to shift some resources and do some reprioritization and free up another 30 rooms of non-congregate shelter for use. Quarantine and isolation is a specialized non-congregate shelter for those that either have tested or travel waiting to see if they have COVID or we know they have COVID, because nothing good would happen with mixing those in a regular congregate shelter. And I talked about that non-critical transportation to make sure we can connect people with testing, vaccines, or if we have to move them between shelters, we can. Next slide, please. Movement to housing. So if we look at how we're going to get out of this disaster, probably the key point, there's a few things that we have to talk about. First, increased capacity of the permanent shelters out there. The Delta variant was kind of a left hook on top of that 1-2 punch where there was interest in expanding capacity. It's created a pause in those efforts. As we work through that or find other alternatives to create necessary separation, there's increased capacity there. The other major push, however, has to be on intervention, as the coalition mentioned, and for those we already have in the system, our outflow efforts. We have entered into using ARPA funding, a intensive housing case management contract with Catholic Social Services. They've onboarded 8 case managers this week. We've already built for them, if you will, a target list of those we've identified as we believe will be easier to house, and others are opportunities there so we can move along and start starting that outflow and that expectation. It's also critical, as the coalition mentioned before me, though, that those other activities funded by are also activated and mobilized going forward. In this disaster, individual assistance was authorized but not stood up by FEMA. That would normally provide for case managers, relocation specialists. Without the benefit of those responding to this disaster, these other programs are critical to our going forward to reduce the current population in the shelter system. I understand there may be more behind it, but we have to address who we already have there. I want to touch briefly upon the self-pay there. These are individuals like I believe Mr. Constant was asking about who have jobs or other means and just need a little help organizing themselves or finding resources to move on to the next step. Through just using our internal staff, we've housed 18. One person was assisting with an airline ticket back to family out of state. Another one, it was assisting with moving in with other family members by just reconnecting them. In many of these, though, it is just connecting the individual with the landlord and kind of helping them organize, okay, I need to get a bill, I need a frying pan, of those efforts. So the job market isn't as bad as last year. It still has created a lot of economic dislocation. There are opportunities out there, though, that as we ramp up these different outreach efforts, I'm confident we can increase our outflow going forward. The 18 that we have housed have been largely without any external resources that we talk about our services going forward. So we're confident that as these efforts stand up, we can make a difference going forward. I also want to touch upon those needing a higher level of service. The individual mentioned by Jasmine isn't the only one out there. We have many, and we have to find a way to improve the process of connecting individuals eligible for those assisted living services, getting them actually enrolled and entitling them. It is very disheartening and troublesome that we can't move those along into something that would substantially increase their quality of life and better accommodate their needs. And I would just note also, I want to, across the, if we look across the community, I look at the ACH dashboard I urge you to. Also, they average about 120 successful rehousing efforts a month. So there's efforts out there, but we see in order to get out the current disaster and stand down mass care, which should be a temporary entity, the biggest thing we have to do at this point is really focus and double down on those rehousing efforts and outreach efforts. That was it.
Okay, great. If you have any questions, please flag me down to get in the queue. I have one. Can you talk a little bit about the utilization rate of the quarantine and isolation?
Through the chair, that was the area where we freed up 30 rooms to reprogram to increase the non-congregate shelter going forward. I would tell you that it is increased noticeably in the last 2 weeks. I believe yesterday we had 11 in there, and it is an area that we're concerned about growth with the Delta variant, which is what's driving that increase. But right now there was excess capacity there, which is what we were able to reprogram to create another 30 rooms of NCS capacity.
Great, thank you. I don't see any other questions in the queue. I did want to take this opportunity to invite any of the providers we have with us today, if they would like to share anything related to what we talked about, whether it's kind of who is in shelter, barriers to exiting shelter. As Ms. Boyle indicated, we would love to invite you up and hear directly from you. Good morning. You have to press the button on the mic. It's not on this time, sorry. There, now it's on. Just please introduce yourself.
I'm Ruby Montefiore, the Director of Outreach, basically, for Choices. And I actually have just one question for Ms. Boyle. You had mentioned earlier that none of the efforts for housing was clients directly from the streets. Oh, okay. I just wanted to, I think I misheard that. But I really wanted to elaborate on that. The efforts of the 100 and, I would say 20 to 30, between 120 and 150 individuals that were housed, A lot of them came directly from camps, but because of COVID, a lot of their access to other resources to keep warm, to get food, were cut off because of COVID. And so a lot of times there's been misinterpretations, which is what I thought happened, but a lot of times individuals think that all of those efforts that happened during that push for HPS, even Catholic Social Services and their efforts, amazing efforts by the way, and amazing numbers, but a lot of those individuals were affected by COVID because they couldn't get access to warmth through, malls were shut down. A lot of their efforts going to, sometimes a lot of the hospitals were really lax about them coming in, charging phones and things like that, well that was cut off. So their only access to those things was going through shelter. And so while in shelter, we were able to capture them and actually house them. In that time, with the efforts of Rural Cap and Catholic Social Services, we were able to empty an entire camp, which consisted of almost 45 individuals into permanent housing. And that was because we were allotted an amazing amount of money. But now what we've seen is a decline in that amount of money put towards outreach, put towards housing, and the way that it was appropriated is just a little bit concerning because, to me, in my opinion, it wasn't spread out evenly, I think, because one agency can't do it all. There's too many. And I do agree amazingly with Ms. Boyle in the sense that that's kind of where we're at as providers is we have individuals that we have taken a very long time, almost a whole entire season, to build relationship with and to build trust with. And now we're telling them, we can't put you into permanent housing even though you jumped through hoops to get the information we needed to make the landlords happy, but now we cannot help you because we've yet to be funded. And we've had people now turn away from us, wanting to just stay on the street, and it's taken so long. So I do agree with her in the sense of how dire it is to please release funding, do what we need to do in order to get funding and in order to get this going, because even though we give them positive opportunities, it's harder to sell when we can't keep our word.
Great, thank you. Excuse me. Thank you for sharing that. I appreciate that, and we will work on with the administration on ensuring that the appropriations get out the door as fast as possible. Welcome, Ms. Sauter.
Thank you, everyone. Lisa Sauter, I'm the CEO for Beats Cafe. I didn't really have any prepared comments today, but I appreciate the opportunity to just address a couple of things. One of the things I do want to, again, give a huge shout out to all of our partners that have come down and supported the clients that have come through the Sullivan Arena, and to the EOC for the assistance that they've provided to us as well in standing up for quite most of COVID, the largest shelter in the entire United States. So I can tell you that Anchorage should be incredibly proud of the work that's been done as a community to make sure that no one went unsheltered last winter, and I hope that that will continue into this winter season as well. A few things, obviously we've learned a lot of lessons over the last 16 months at the Sullivan Arena. We were able to stand up a model of shelter that has never existed in Alaska. And that itself as a community is something, again, we should really embrace and look at what are the lessons learned, how can we improve this, and what happens next. And I'm happy to be part of those discussions. One of the things that I know we've done as an agency, we're trying to change the model of how we engage with people who are coming into the shelter. So instead of having really an opt-out model for navigation services, we're trying to move to, instead of an opt-in model, we're trying to move to an opt-out model, meaning that everyone is asked numerous times, if they're willing to engage with a navigator. We choose to use that vernacular just because I found that with many of our clients, as we just heard from one of my partners, a lot of people have had great relationships with case managers and agencies, and then funding drops off and they don't get housed and they're incredibly disappointed and feel lost and hopeless again. So we're trying just a little bit different term to get people to possibly engage that haven't felt comfortable in certain titles or certain roles. So we use the term navigation, and so what we're doing now is having navigators be on the floor, going bump to bump, talking to clients directly, asking them what are your immediate needs, what other options do you have, where could you be besides here, what can we do to assist you with that? And then knowing the inventory of our partner agencies, it's much easier to make that connection to the partner agencies. But again, the funds have to be there in order for the people to be able to have the outflow. So we've been really excited to see what our navigation team has done. We've also added 5 additional positions to our navigation team, and these are all folks with lived experience. So we are calling them kind of navigation interns. So they're basically peer-based navigators who are being trained to be professional navigators and working side by side with our professional staff. Currently, with the contract at Sullivan Arena, we have 1 navigation position that's funded. We have 9 additional positions that we as an agency have taken on the responsibility of securing funding for. So I just want everybody to understand that, we have a lot of skin in the game in this area, and we really understand the importance of it. We have the bulk of the people that are in one place there, and we take that very seriously, and we want people out of there and into a much better position as quickly as possible. So we're really trying to do that on a daily basis.
Great, thank you so much, Ms. Sauter. That's very helpful to know, and I will look for an update on the navigator interns. That sounds like a fantastic program you're piloting. Thank you.
You bet. The one other thing quickly I want to mention too is we do have a number of people in the shelter that are working that we just need access to funds to get them from there into an apartment. And not only do they need help with the applications, which our staff does some of it, but they need the dollars. And so we're trying to figure out the best way to do that. We have a shelter to success program that we piloted, and we've got probably about 20 people right now sitting in shelter that if we had funds through a partner or through the muni immediately released, we could get those people out and into housing immediately.
It would be really great if you could follow up with us about how many and kind of what that barrier is, so we can put some numbers to the need. Thank you.
Thank you.
Mr. Constant, please. Ms. Sauter, maybe don't go away quite yet.
Not necessarily for Lisa, it's, let's ideally get all of that information from a variety of providers into one place, because having it for one is important, but having the whole picture is more important. Thank you.
Great, thank you, Mr. Constant. All right, I think we have someone from Catholic Social Services and Brother Francis.
Hi, thank you, everybody. My name is David Rickberg. I'm the program director of the Brother Francis Shelter. To give a little bit of background, when COVID first arrived in Anchorage last March, we recognized that there was going to be a need in the community for additional shelter beds as increasing space between people became important, and the community stepped in with Beans Cafe, did an amazing job opening up the Sullivan Arena, but we also recognized that there was going to be a special population that may have difficulty accessing that building just because of some space concerns. So Catholic Social Services and Brother Francis Shelter changed our model to be responsive to that need, and we're serving primarily people that have complex medical needs. Our criteria at the shelter is, can you climb the stairs at Sullivan Arena safely? And that is a self-report. We know our clients really well. That's something that we really pride ourselves with, and something that we base everything that we do upon is the relationships that we build with the individual people that we serve. So we reduced our capacity from 240 beds to 62, plus 10 beds in our medical respite program, which is a recuperative care area of the shelter. There's 5 rooms in the back with there's semi-private rooms, 2 people to each room, and we take referrals directly from the hospitals in the area for people that just need a little bit of rest and recuperation before they can get back on their feet. In addition with that, we have an embedded clinic run by South Central Foundation that really positioned us well to serve this population. That clinic has been in operation at Brother Francis Shelter for about 4 years now. And so the people that we're serving really have a lot of mobility challenges and complex medical needs. The majority of the people that we're serving employment is not necessarily going to be their solution to their individual problem experiencing homelessness. Some of the barriers that we are experiencing are just that. Is a lot of the people that we're serving are going to be applying for Social Security or other types of benefit programs, and unfortunately that process just moves relatively slowly. We are currently starting an assessment push with the Anchorage Disability Resource Center, or the ADRC, I can't remember the exact acronym right now, to assess people, to really dive deeply with the individuals that we serve, to really find out what specifically are those complex needs and what are those barriers. But just to sort of like name a few, a lot of people have been chronically homeless for quite some time, people that we're serving. A lot of people have mobility challenges. Someone mentioned a story about an individual that is in a hotel that doesn't have any hands, and I have at least one person that doesn't have any feet. And so we're seeing a lot of people that just have very complex needs where a simple solution like paying a first insurance security deposit isn't necessarily going to give some long-term stability. A lot of people that we're serving are going to need permanent supportive housing or some sort of assisted living. Assisted living in Anchorage, I know there's a lot of providers that work very hard and do a very good job, but they're sometimes getting people into assisted living can be quite a lengthy process, and also client choice is a factor there as well. A lot of times in an assisted living facility, the assisted living facility, and arguably rightfully so, will take a lot of that person's resources to help pay for that, and sometimes they're resistant to giving up, what little resources that they may have. So I think Catholic Social Services, we're committed to making sure that this special population that has unique needs has a place to go that is going to meet those unique needs. I think all shelter providers in Anchorage do an amazing job serving the people that they do, but I think we also recognize that this specific population has very specific needs. And so some of the things that we have done is we've done a full bathroom remodel this past winter and added some individual showers. We still do have concrete showers in the back, but we have added some individual showers for people to use. We also brought in personal care attendants that are there a couple days a week that assist people with different daily needs living, and whether that's going to be helping them take a shower or teaching them skills about how to get dressed or different types of things like that.
Great. Thank you, Mr. Rittenberg, and thank you to Catholic Social Services and Brother Francis for really stepping up and meeting the need of these vulnerable individuals. And hopefully we can all work together to try to figure out the right combination of services to get them into permanent housing. Appreciate that. Do we have any other providers with us? I think we have Covenant House and Downtown Home Center, and that will probably run our time. We have about 5 minutes remaining. Ms. Lordy, please go ahead.
Yeah, Sherry Lordy, Downtown Home Center, and I'll make this quick. We right now are at capacity with 50 women. Our women are basically, most of them come out of the sexual exploitation and trafficking. They come out of horrendous situations. They come out of trap houses. They come out of hotels where they've been used. A lot of very traumatized women, and you've all heard a lot of this. So we found even more things lately. They're being sold in tents, and the girls themselves are actually joining together to go find the other girls that go missing. So it's pretty traumatic around there. I work with other shelters when somebody comes in on all of them. If we have somebody with medical needs, I'm going to call Dave. Lisa, if she has somebody that would fit our shelter, we'll send them to us. So we do a lot of coordinating with other shelters. But at one point we were at 70 beds, but during COVID we went down to 40. Now we're at 50. We bought cots instead of mats now, so we're a little more. It takes up more room. They all have
their own personal space with a table and chair, that kind of thing. Several of them are in the culinary school and in the bakery, see the food truck out around the community. So we're trying to help them transition back into more normal life. We have trauma care too, counselors that come every Monday and work with them. And right now we're trying to purchase a little nearby boutique hotel so that we could take some of the gals that really need more time, can't go into individual living on their own, where they could live and have the closeness with us, the trauma care and rehab. So we're just kind of moving with the times.
Great, thank you for the update, I appreciate it. Thanks, Ms. Lori. And I believe there's someone from Covenant House.
Hey, Jack Flowers.
Can you pop the mic up so you're not, there you go.
Okay, I'll be brief. So we've been operating 40 shelter beds, but we also have a wide array of other types of housing, from transitional living up to being able to do voucher-based housing in apartments. But I really just wanted to speak briefly about the complexity. I know that multiple people have brought this up, but the complexity of housing folks who are experiencing mental health and substance use co-occurring, and oftentimes, are using substance to medicate an unmet need when it comes to mental health. And so, what we see at Covenant House, and we see this across, I think everybody would say this, that the complexity of that really brings challenges when it comes to finding appropriate housing outcomes. And then second, I want to just add on to what Lisa said about navigators. We've been able to pilot a navigator model through a penetration project in 17-18 at the request of our young people. And we've been able to have like a 90% success rate with those navigators when it comes to helping someone accomplish a goal. Meaning that if they need an ID today, they need housing today, if they need food stamps today, our navigators are able to accomplish those things. We've been with them and had a 90% success rate. So in thinking about multiple types of housing interventions, and then that one-on-one support to be able to meet those needs.
Great, thank you. Mr. Constant, you might want to wait a second.
So just this morning I went on a walk and I noticed that you moved the navigation center into a small house. When did that happen and what's the plan there?
So that happened about a year ago. We moved over because we were having, with our facility, the primary place where we were serving our non-residential youth was through that front door. And with COVID, that was getting more challenging, so we ended up moving over to that space. We are still doing some things when it comes to non-residential services now, especially with COVID setting back a little bit through that front door. But right now, we have that lease for another year about. And so our navigators are housed out of there and being able to support young people there. Yeah.
Thank you.
Great, thank you. Thank you. Do we have any other? We have one more provider. Okay, and this will be it. I know we're out of time. Do our members okay extending by about 5 minutes? Okay, please go ahead.
I'm Robin Dempsey. I'm the Chief Program Officer at Catholic Social Services, and thank you so much for having us here today. I just wanted to mention quickly about some of our other housing initiatives that we have. I know that there's a lot of housing initiatives that are happening within our current community, but we have about 10 different grants that we work from to house people, and each different grant, I think has been mentioned previously, has different criteria and different things that we need to look at. But recently we have been selected for the intensive case management program. We're super excited. We've got a team, as Bob said, we're onboarding and we're going to be starting to connect with people this week. But there are other housing programs that we have as well, like our SSDF program. So we housed over 100 homeless veterans in this past year. And I know our time is short, so I can't get into all of it, but I'd be more than happy to talk more about this at any time if you're interested in some of the other programs that we have.
Yes, that would be fantastic. Thank you. Thank you for sharing with us. All right, well, that concludes our time for today. I do want to thank everyone for presenting, and thank you to the providers. While we often talk about data and need, it is great to hear from those of you who are working so hard to serve those individuals experiencing homelessness. And thanks to Mass Care Operations for presenting with us all. And with that, we'll be adjourned. Thank you.